From Faithful Word Media, this is Healthcare Musings. I'm Dr. Hashem Hasabala. Welcome, everybody, to Healthcare Musings. Hashem Hasabala here. So happy to have and honored to have Dr. Sergio Zanotti. He's the Chief Medical Officer for Sound Physicians, my employer. That's full disclosure. Literally the grandfather of critical care medicine. So happy to have him on the show. So Dr. Zanotti and I go back a long time, and I'll tell you, I have a couple of stories of Dr. Zanotti. The first time I met him, he was, and correct me if I'm wrong, Dr. Zanotti, he was a chief resident at Rush University, and I was doing a rotation at a hospital in the Rush system, and I was caring for a patient with hepatitis C, and I had a near miss with a needle stick. So I'm panicking because, back then hepatitis C didn't have a cure. I was freaking out. So I went to him and I showed him my finger, and he looked at it, and I'm panicking. I'm freaking out. And he's just calm. He's always, as long as I remember him, he's just been calm and soothing. And he's like, dude, it's fine, man. It's fine. And he squeezed my finger and he's like, bro, it's fine. You're okay. And he talked me down from the ledge. So that's the first time I met Dr. Zanotti. And I was super excited when I matched into the Rush Pulmonary Critical Care Program. He was there, and so was Dr. Dellinger and a whole bunch of huge names. And then they all went to UMDNJ, Dr. Zanotti among them, and left us kind of left us in the lurch at Rush. And they actually named a teaching award after Dr. Zanotti. So really, I have royalty here on Healthcare Musings, and I couldn't be more thrilled. So Dr. Zanotti, welcome to the program. Welcome to the show.
Dear Hashem, thank you so much for having me first. I mean, it's a true honor, and also thank you for the kind words. Uh, as the only thing I'll correct you on the introduction, that the only thing I'm grandfather of is a beautiful little girl called Camila, who
That's
turned
right.
7 months a couple of days ago. So happy to be here and talk about critical care and other topics.
Absolutely. Dr. Zanotti is host of Critical Matters, the premier critical care podcast. He talks about clinical topics, brings true experts in the field to talk about various clinical topics and ask him about medicine and critical care. Everyone should listen to the podcast. It's fantastic. And so, like I said, I'm super stoked that he's here. The other story that I want to begin our conversation was in the pandemic almost 5 years ago now. I texted him. He and I were both at Sound, and I felt weird, and that's why I texted him, because I felt weird. And he again talks me down from the ledge a lot. And I called in a prescription for hydroxychloroquine, and it was not very not very available. A lot of people were getting it, and I felt bad because I wasn't sure about hydroxychloroquine, and there are people who really do need hydroxychloroquine for their autoimmune disease. So I texted him because I didn't feel normal, and I said, I just called in a script for hydroxychloroquine. Am I crazy? And he said yes. So then I responded, well, what if I get COVID and it works? And what made me not get the prescription, he says, what if it doesn't and you go blind? And I'm like, good point. And so once again, he talked me down from the ledge, and I called back the pharmacy. I said, I don't need it anymore, and then the rest is history. So I wanted to start there. So from your perspective, and you've done a lot of webinars and talks about COVID and the response of clinicians and physicians to COVID and the public health response. Now that it's crazy. It's been 5 years. What do you see that happened to us throughout this whole situation? Now that we have had time to reflect.
Well, I think that obviously it's a lot easier to reflect in retrospect. But the first thing that I have appreciated over the years, and even made a big point of focusing and refocusing during COVID, is that we're prisoners of our own perspective in terms of time frame. So all we knew what was in front of us. But when you look at human experience, there's been worse pandemics in the past. And a lot of the behaviors that we saw during COVID were exactly the same behaviors that were saw with the Spanish flu and other pandemics like the plague many years before. So human behavior doesn't change that much. We just think that what we're experiencing is quite unique, but a lot of things with their differences have occurred in the past. And I think, Hesham, as physicians, what's important really is always to focus on the process. I'm a big believer that the process is more important than the outcome. And you can have the wrong process and with a little bit of luck, get the right outcome. Or you can have the right process and with a little bit of bad luck, have a bad outcome. However, if you're always trying to improve your process over time, you're much more likely to have more good outcomes than bad outcomes.
Mhm.
And I think that whenever we deviated from our usual processes, we got into trouble. Of course, we're all scared. We don't know what this means. Of course, we are all worried about our patients, ourselves, and our families. But the truth is that if you were not in a pandemic and I told you, hey, this medication might work, if you're very desperate, some people might try it. And I guess that's the idea, like what they call Pascal's wager, that I don't really believe it works, but what if it does?
Right.
And I think in some situations I could understand that, but when you have millions of patients, I think you have to be very careful for a couple of reasons. First, you are focusing on something that has no evidence, and there's what I always talk about is the cost of missed opportunity.
Mhm.
Instead of focusing on things that do work, or we have more evidence that could work, or focusing our efforts on researching things that have more potential, right?
Mhm.
We are wasting time, energy, resources on things that really have no bearing that other than somebody said this might work based on very, very loose scientific evidence. Number two, unintended consequences. Every drug that we give can give somebody a problem,
Mhm.
right? I mean, I remember prescribing as a resident hydralazine to somebody for blood pressure, and they came back weeks later with drug-induced lupus, very
Oh,
sick,
wow.
right? I mean, now that's not uncommon, but it's described. So you have to be very humble when you give people things. And all these medications that were utilized at normal doses could have reactions, but also I think they led to this mass hysteria. People were using it probably outside of the parameters that they're usually described. So I think we have to be very, very careful. And when you look in retrospect, if somebody would have done a trial and showed that it worked, I'm all for using it. No problem. As a matter of fact, when the pandemic started, based on previous recent viral influenzas, pandemics, I was really against. I thought that the evidence suggested we should not use steroids. Okay, well, I was wrong.
Mm.
They did a study, a large study, several studies, and the evidence suggests now that we probably should be using steroids, right? Is it a
Right.
lifesaver? Probably not, but it's important. So I think that we have to be disciplined and checking our own confirmation bias, because
Mhm.
for whatever reason, two people are exposed to the same idea, hydrochloroquine works, and without any reason that we can explain, one person might think, yeah, that makes sense, and the other one might say, no way. And then what happens is you're the person who says that makes sense is always looking for evidence that confirms their belief, and that belief becomes stronger and stronger and stronger. And the person who said that's not going to work is always looking for evidence that supports that belief, and that
Right.
becomes stronger and stronger and stronger. That's normal human behavior. I
Mhm.
think true scientists are able to recognize that, say, hey, I seem to have a hinge against corticosteroids, but what would it take for me to change my posture? And I'd say, I mean, reasonable evidence. They did the studies, which is again a monumental feat, right, of the people who did the study. I mean, in the middle
It
of the
was.
pandemic, they did amazing studies, and it changed my perspectives. Okay, based on this, on the best available evidence, we should be using this. And I think that vitamin C, hydroxychloroquine, and some of these other drugs that became kind of more of a political stance in some respects in a war, the studies have not shown that they make any difference.
Right.
So at one point you got to say, okay, the studies are just not there, right? So I'm going to move on because there's also potential complications. Recognizing that we don't know, we don't have always the truth, and studies can change your posture. I always say that we believe, or physicians talk about themselves as scientists. We're not. We don't behave like scientists. We're
Interesting.
we're
Interesting that
we're
you think that. Hmm.
we're clinicians,
Hmm.
and we learn a craft, and a lot of what we do is based on science, but a lot of what we do is based on what we learned. And over and over again, you will see that it's very difficult for physicians to change their mind. Perhaps one of the purest groups, I mean, I hate to throw stereotypes, but of true scientists are physicists.
Hmm.
Physicists, right, take theories as the best working evidence, but they are able to even refute their own theories when they get better evidence. That's true science, right?
Right.
Based on what we know today, this is the best we can explain this. Oh, by the way, we got better and newer evidence. We were wrong before, right? And
And that's hard for physicians to do. That's hard for us to say we were wrong. You think?
I think it's super hard. And just
Interesting.
look, just let's walk away from COVID and let's talk about critical care.
Hmm.
There's still people arguing that we should cool people post cardiac arrest.
Oh, right. Yeah, you're right.
Now, I don't know if that is right or wrong. I believed wholeheartedly that therapeutic hypothermia made sense from a physiological standpoint. It made sense in animal studies, and from a couple of studies that really had like hundreds of patients, low hundreds, had an impact on outcomes. So we did it
Mhm.
for a decade. Now we've had several studies in the thousands that show no difference. And yet people are saying, well, but if, but this, that's confirmation bias. If you're a pure scientist, you value the studies as, okay, these are better studies than we had before. They're larger studies than what we had before, and they show no difference. And in some cases, it might show harm. Maybe we shouldn't be doing this. Now, if you're still curious and you think there's equipoise, let's do the studies. But
Mhm.
let's use the studies that we have to inform our conduct. That's what scientists do. And I think, Hesham, that over and over again, I see people have a very hard time letting go of their babies, right?
That's true.
If you believe in something, you keep doing it, right? And so I don't think that we behave like true scientists, to be honest.
That's wow. That's very interesting. Going back to when you said the process is more important than the outcomes, you and I have discussed this before. The problem is we're held to outcome. I mean, you can't measure process, right? The only thing you can measure is outcome. I talk about with insurance companies, if we do such a good job and we prevent someone from becoming septic from an infection and they get better in 24 hours and they go home, the insurance company's like, well, why are we going to pay for the inpatient level of care? Look, they went home after a day.
Yeah.
That's our outcome, but that's also
Yeah.
process. We're not
Well,
we're not rewarded on process.
yeah. Well, and I think that the misalignment of incentives is a topic that at a different level, and that
Hmm.
is arbitrary and it's made up. It's how people get paid for services. I think
Right.
there's a lot of issues there. However, what I would say is that in medicine or in let's use, you know what we can use actually as an analogy? We can use poker.
Hmm.
So poker is a game of chance that actually has skill.
Right.
So and professional poker players make money because they're very skilled at playing each hand based on probabilities. And what they know is that when they're learning, they're more interested in did they play the hand through the right process, because that's reproducible, than did they had luck. So you can play against the best poker player in the world and you can beat him a hand or maybe even a couple of hands, just pure luck. You get
Hmm.
better cards, you're gonna pure luck. However, you're not gonna beat him over time because over time the process will matter more. And you can use the same thing in medicine, right? Um, think about your process and how can you improve your process. Detach that from the outcomes as you learn. And eventually what you'll figure out is that, yes, you get measured by outcomes, but your outcomes will be better over a larger sample if you have worked on your process, right?
Yeah, that makes sense. Yeah.
And whenever you have a patient, think about what did I do well? What can I do better? What did I learn? regardless of the outcome, right? Sometimes you just get lucky, or sometimes you do everything right, and you still the patient die. That's the reality of what we do.
Right.
But if you see people who are very, very dedicated to the process, invariably over time, Hesham, their outcomes are better.
Yeah. No, that definitely makes a lot of sense. We you said we're not scientists, and that's I've never, we always say we are, we think we are, we wear the long lab coat. We Do you think the pandemic has hurt our credibility as clinicians because some of us are refuse to let go of beliefs? It's almost like a religious belief sometimes in the things that we do. It's not, even
Yeah,
though, and hypothermia was, well, I was like, after one study after another, I became skeptical. But you talk to the people. I went to a conference and I just mentioned goals of care conversations, and they all looked at me like I had five heads on. Like, it was so
yeah,
weird. They were all believers. The entire place was all believers, and they refused to let go of what I think many of them, they based their entire careers on. Like,
yeah.
what do you think about that?
So I think that the pandemic, as time goes by, I mean, is less relevant. Probably when we were there, it felt like it was a whole world. I think the
Mhm.
pandemic didn't show any different human behavior. It just accelerated and magnified things because of the nature that, um, if you think about it, every day there's all the things that happen in the pandemic are happening all over the world at different times or
Right.
in our practice. During the pandemic, it's like everything synchronized and the volume went out. So everybody was experiencing a similar reality. But the way people behave, I think, is no different, just like was accelerated for many reasons. Regarding thinking like a scientist, right? I think scientists really have more doubts than certainty. Real scientists are trying to refute their ideas. Clinicians are always trying to support their ideas. That's the bottom difference between behaving like a true scientist and behaving like a physician or a clinician, right? It's more likely than often that clinicians trying to explain to you why they're right versus a real scientist. Like if you look at Albert Einstein, Charles Darwin, like I mean, among the greatest scientists in history,
Hmm.
they had a theory and they would constantly try to disprove their own theory, right? They are
Yeah.
trying to crack their theory. That's how they know it's a solid one. We just try to justify ours, right? So we do what I call reference-based medicine, right? You find a reference that supports what you say, and you conveniently quote it, right?
Well,
What about
I
yeah?
do that with
We all
I
do
do
that,
that with
yeah,
fluid boluses.
yeah, yeah,
My nickname is Dr. Hasabolus in the ICU, and I have randomized controlled data to back up
yeah,
what I do. But the difference also is scientists don't have a living, breathing human being who's at risk of dying in front of them. They have, I don't know, molecules in a things in a pipette, or
I agree.
atoms
Well,
in an accelerator. It's different.
it might be,
The
yeah, and
the
again, I
stakes are
think
higher, right?
I agree, and we're trying to provide comfort and heal, and yes, you're right, but that's where the other part of being a physician or being a clinician comes into role, right? Um, your compassion, your ability to have true empathy, your ability to communicate, and that's the human part, which I think is super important. I'm not saying that, and when I say we don't behave like scientists, I don't say it in a negative way. I
Hmm.
think we do something that for a patient might be much more important than a scientific approach, right? We are providing comfort and support, even even when you know there's nothing to do in terms of curing a disease, or you know the patient's going to die. Good physicians can make a huge difference, right?
Right.
And that I think is much more valuable, much more real than thinking like a scientist. We're healers, right? And I think that's ultimately what matters. Now, science helps us heal more people probably, but
Hmm.
we also need the other part for sure.
Yeah. No, absolutely. And you don't want to give something like hydroxychloroquine. I mean, what I saw, it caused arrhythmias in a bunch of people, and we just stopped using it because it was causing harm. And we just
Yeah.
said, this is ridiculous. I think in the past, And I'll confess, in the past, when I had colleagues, I say, "What's your evidence?" When we talk about this, that treatment, I roll my eyes. I'm like, "Oh my God, you and the evidence." But I think the pandemic taught that you really need to have evidence. Like
Well,
you
and
really need to have science, like science, quote unquote, science, to make sure that what we're doing is not just random chance and you're not harming people, right?
well, and I think that the other thing that's important is to be very honest with yourself, right?
Hmm.
So, uh, Richard Feynman, who was a Nobel laureate in physics, a true scientist, had a quote that he often said that said, "The only person you can't fool is yourself, yet you're the easiest person to fool." So I always say, okay, I'm going to do this. Why? Right? And sometimes the answer might be because I don't know what else to do, but be honest, right? Or you might say because based on what I understand from physiology, it might make sense, or based on the poor evidence that we have, this could support. And I
Hmm.
think that there's levels of evidence to support what you do, but also I think that you have to balance that with scale. If you're going to say everybody do this, you better have good evidence
Yeah,
because
right.
the potential for the missed opportunity and the unintended consequences is now multiplied by a million, right?
Right.
If you have a patient one patient truly dying, you're going to try something as a last ditch effect. Okay, you understand that it's a last ditch effect, but it's one person. So even if the missed opportunity and the unintended consequences are contained. But I think the danger with the pandemic was that this became like mass hysteria, and now we're talking about millions of people doing something. So the likelihood of somebody having a real problem could outweigh the likelihood of somebody having a real benefit. And that's
Yeah.
also part of what you have to figure out. Yeah.
Yeah, no, that's very true. That makes a lot of sense because the implications can be huge. And well, looking back, the things that I thought were anathema, or I just was shaking my head on a lot of people who were noted to be contrarians, turned out to be they turned out to be right,
Yeah.
right? Like vaccination doesn't prevent you from getting infected. It didn't stop spread. I think it helped people not die. And I think that was the point, is that we're being inundated and overwhelmed, and we
Yeah.
just don't want people to be vaccinated so that they don't die. And I
Yeah.
think there are masking kids and maybe the school closures, all these things that now we're looking back, well, looked like the contrarians were right,
Yeah. Well,
you
and I
know?
think that we don't have the full evidence yet, right? Because a lot of the recommendations were based on previous experiences, but the reality of the world and of each individual pandemic might be different. And I'm not a public health expert, so I can't really talk
Right.
about that. But think about just in basic terms. Every year I get the flu shot,
Me
and
too.
I've got the flu, I think, a couple years ago, but I didn't have to be in the hospital. So
Yeah.
does the flu shot prevent you from getting the flu? No. Does it prevent you from having a severe form of flu? Yes. And
Mhm.
that's good enough, right?
Yes.
And I think that maybe we were expecting too much from the vaccines, and that wasn't articulated very well. But a lot of the diseases, a lot of the vaccines that we get really just ameliorate the disease, right?
Yeah.
And I think that there is I mean, when you have so many people getting sick, being in the hospital or being home is a huge difference, right?
Oh, yeah.
And you're right. I mean, like at this point, for example, um, I got my flu shot. Did I get a COVID vaccine? No. I'm not immunosuppressed.
Me too.
I'm not 65 and above. I don't think that makes any difference for me right now, right?
Hmm. Hmm.
But yeah, I mean, a lot of things also, I think it's hard also for people when everybody's so nervous to accept we don't know. People
Yeah.
want answers, and when we don't have the right answer, we make up answers. But yeah, there's a lot of lessons learned. But I can also guarantee you that if we have another pandemic, I'm gonna be a mess again.
You don't think we've learned lessons? You don't think you think it'll
Some,
be the same?
some, but not all. Yeah.
Yeah.
Eh,
Well, we were scared. I mean, in the beginning, like that's why I texted you. I felt weird, but I was scared. I was
yeah.
legitimately scared. And it's really hard to practice with fear. It's really hard to practice with fear.
Well, and I think again, the reality, Hashem, is that the fear is just uncovered as opposed to new. In terms that the risk of of anything happening to you on a daily basis is always there,
Yeah.
right? there's just certain circumstances that make us more aware,
Hmm.
right? But the reality is that you never know what's around the corner. You never know when you intubate somebody. I think that if anything, it's helped us, right? I mean, I remember intubating people without a mask
Oh, me too.
all
Oh,
the
yeah.
time, right?
All the time.
Now, not going to do it, and it makes sense. I
Never.
mean, you could get, who knows what you could get, meningitis. You could get, right. I mean, some influenza, and that could
Absolutely.
also, I mean, end up being devastating for the individual person. So yeah, I think that hand hygiene, using masks, some precautions. Yeah, I mean they definitely make sense for any disease. So that's a plus. But yeah, I think that that it's always, I think the key is always to be humble and recognize that there's so much more that we don't know than what we do know,
Yeah.
and focus on the things that we can focus on.
Yeah, absolutely. I mean, you're you're absolutely right. I mean, that my practice has completely changed with respect to intubation, and I never ever intubate. I intubate with an N95 now all the time, where I never did that before. That's a very good point. You know, this timing of our podcast is so poignant. I just read today on a great Substack called Sensible Medicine, where they asked six doctors what's gotten better and what's gotten worse since they started in medicine, and wanted to ask you that question. What do you think has gotten better, and what do you think has gotten worse?
So I think that without doubt, the um the availability of certain treatments and the things that we can do for human beings from a technical, from a medical perspective keeps getting better.
Hmm.
Um, that there's no question in my mind. I think that the other thing that keeps getting better is uh, care for certain specific subgroups of patients.
Hmm.
So I've been a clinician. I finished med school 30 years ago and been a critical care doctor for whatever, 25 years, right? 24 years. Um, the outlook for patients with cystic fibrosis, dramatically better.
Right.
The outlook for patients with HIV, dramatically better. So there are diseases that clearly we can do a lot more for. And people can almost, like, from having a death sentence, have an almost normal life.
Well,
Um,
that's why I was scared about my Hep C. Remember, because back
yeah,
then,
yeah.
that's it.
So,
It's
so,
over.
so there's no question that that has improved. What else has improved? I think that clearly what's improved is a recognition that it's a team sport. There's still a lot of room for improvement there, but I think slowly um, behaviors that are not conducive to psychological safety and true team performance are being recognized as being hurtful.
Hmm.
And slowly, I think we are appreciating that everybody in the healthcare team brings an expertise that's unique, that when leveraged in a way that creates synergy, can benefit patients. So those are two things that clearly I think have improved. What has gotten worse? Well, I think that there's clearly a feeling of loss of autonomy. There's clearly, I think, at least in the United States, right, a misalignment of incentives. On one hand, we complain about a lot of things, but we also have to recognize that physicians, compared to other places of the world, are paid very handsomely in the United
Hmm.
States. We could argue all we want about the value of work and how people should be paid. From a very practical standpoint, I think that money is an instrument and people get paid for their ability to make money for others. And that is why LeBron James makes a lot more money than any physician, because he can truly make a lot of money for a lot of people. He's also obviously an outlier in terms of performance, but he plays basketball, which is a game, right?
Right.
But there are complicated issues, I think, in terms of misaligned incentives. Are we doing what's really best for patients? How can we control cost? And that's a very difficult conversation. And I don't know that I have an answer, but
Yeah.
that feeling, I think, gets a little bit worse. The other thing that a lot of people would argue got worse over time, and I don't know the reasons, but physicians have historically um, benefited or have historically possessed a very high level of respect from the community.
Right.
That has changed, but it's true for a lot of other people. That's true for teachers. It's true for a lot of other people in professions, and so that has got worse. However, I still believe that at the individual level, physicians who are compassionate, who have ownership of their patients, who show that they care and have and try to get better, have tremendous respect from their individual patients. And perhaps that's more important, right? I think that
Right.
when we talk about society, it's one thing. When you talk about the person who's taking care of you, it's a very different thing, right? So that might
Yeah.
be another example of something that got a little bit worse. But again, I think that overall, the truth is that if you're a patient, you're better off today than you were 100 years ago, period. Full stop.
Oh,
There's no
no
question about
question.
that, right?
Absolutely. Yeah.
But there's still a lot of things that we need to keep improving and keep learning and keep working, I think, towards medicine,
Yeah,
improving
absolutely.
medicine.
Speaking about that patient, it made me think of I had a podcast episode where I talked about the American Society of Clinical Oncology recommends palliative care early, but they surveyed oncologists, and I couldn't believe zero refer to palliative care early. And it made me think about all the palliative care that we do in the ICU, and it's too
Yeah.
late when we do it, right? I
Yeah.
wanted to get your thoughts on that.
Well, I think that we definitely should be more balanced. And on one hand, I think that care that's concordant with the goals of the patient are super important.
Hmm.
But also, I think that so that's on one hand, and that is where palliative care or supportive medicine comes in, identifying those goals. How can we help the patient? How can we support the patient to those goals? I think that sometimes we might provide a reality check to what's really going on, but we have to be careful not to be too nihilistic because even if somebody can't be cured, their goals might be very different.
Hmm.
And are we really respecting those goals and working towards those goals, right?
Right.
If the patient says, I want to live as long as possible, no matter what, that's their goal. So then how can we support that goal in a realistic way? So I think that having that balance, I think, is very important. There is two things that I can recommend your listeners, Hashem. There's another podcast, very well produced, called Hidden Brain. Obviously, this is a super highly produced. I think it's from NPR. I don't know who does it, but very good stories. And there's an episode called The Ventilator. And
Okay. I'll put it in the show notes.
yeah, I think that people should listen to that in critical care because it gives you the story of a trauma nurse who was all for palliative care and making people comfort care when they need it, and then developed ALS.
Mm.
And when it was her decision, she went with a ventilator to her death.
Wow.
And again, I mean, just recognizing that we also don't know what we want when we're faced with that decision. So being a bit more humble there and try to ask more questions. What do you want to achieve to the patient and trying to align with that? And I think the supportive medicine can help us there. And then the other thing that I would recommend, there's a book. I think they made a movie out of it later. It's called it's either The Butterfly and the Diving Bell or The Diving Bell and the Butterfly. I don't remember which is the order. It's a
Okay.
very short book
We'll put that in
and
the show notes too.
fascinating. And that is something that I've gifted often because I think it's very humbling for an ICU doc. And basically, it's the true story of a very powerful, uh, kind of in the peak of his career, editor of one of these super famous um, fashion magazines in France, who at age 42 had a massive stroke.
Oh my God.
To make a long story short, he was locked in, and they
Really?
were talking about making him comfort care, and he could understand. They
Wow.
eventually figured out he was locked in, and he actually was discharged from the hospital, could only blink, but he wrote this book blinking.
Really?
And that was his mission in life, to leave this book for his kids. He then died, obviously. I mean, you're not going to live forever with all those complications, but it's a very powerful book, very short. It just shows you that we don't know what really people want or what's going on, so we have to be very careful. And in the same way that a scientist asks more questions, we should always ask more questions and not believe that we know what's right for the patient. right? I think that's very important.
Yeah. Do you think we lose credibility if we say to our patients, I don't know?
I think it depends when. If all
Mhm.
you say is I don't know, I'm sure you do. But
Right.
I think that recognizing uncertainty when it's appropriate, I
Mhm.
think can give you more credibility,
Yeah,
right?
that makes a lot
Yeah,
of sense. That
yeah.
makes a lot of sense.
Um,
But
yeah, but you can't overuse it. Like if everything they ask you, you don't know, I think they say, well, what the hell? You're taking care of me, right?
that's true. That's true. And sometimes, but a lot of times, and I published actually a letter to the editor at Critical Care Medicine, the journal. Sometimes we hedge and do those things because we're asked unknowable questions, like unanswerable questions. Like
Yeah,
they keep asking us things that we don't know,
yeah.
that we can never know. So how are you supposed to do that? You know?
Well, I think that that's an art, right? When
Mhm.
they ask you a question like that, that's a great question, but we don't have the answer to that, and nobody will be able to give you the answer for that. But what we do know is that people with similar diseases, blah 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 blah, blah, right?
Right,
So I
right.
think that you have to be able to manage uncertainty because that's an important part of practice, but also of life, but in the right context. Yeah, and that's just I think a bit of an art. But I think in general, people do appreciate your investment in their care, ownership. They do appreciate your honesty, your integrity, and they more than anything will appreciate how you make them feel. Are you really listening to them? And are you really trying to understand what's best for them from their perspective? And I think that those universally give you more credibility.
Yeah,
Yeah.
no, that's great. That's awesome. That's really good advice. Um, I'm not going to get into it, but I have strong feelings on the training, how it's changed, and what it's done to trainees. And I might save that for another guest or a podcast or whatever. But what advice do you have for, because you've been in academia, you've taught for decades, literally. You've taught me a lot, and I'm so blessed to have you in our group. What advice do you have for those coming out or in training now, who are going to become practicing physicians? What advice do you have for them?
Well, I think that the advice I'll give is the advice I gave my son-in-law when he finished med school, went to med school. And this is based on my own experience. So I'm a big believer in understanding your core values. I have three core values that are most important for me. Number one, learning. Number two, to be of service. And number three, to be kind. So I think that if every day I can learn something new, I can do something for somebody else, and I can be kind to somebody else, I'm going to move forward. And I think that that's really the way that I approach things, and people can have similar constructs, but it's not the song, it's the singer. There are people who are being trained today that are amazing physicians, and there are people who were trained before who are not so good physicians. So I think that
Mhm.
we like to comment on the differences, but the reality is that there's things that are evolving and the needs are evolving, and I think that there's good and bad with every generation. The question is just to be very intentional on how you want to practice, right? So if you, I think most people live and practice by default, and if you really want to be excellent, you should do it by design. What are
Right.
the things that I'm going to do different? What are the things I'm going to work on? And if you every day do a little bit over time, it does, an enormous difference, right? So I got great advice from somebody who I consider one of the smartest people I worked with. And what they said is, if every day of your professional life you took 10 to 15 minutes to learn something new, over the course of years, you'll be far ahead of everybody else in your colleagues. And that is true. I think it's the value of consistency and incremental gains over time ultimately gives you great results. So instead of saying I'm going to read for 3 hours every day, which is not going to happen, say, what can I read today? One thing, and learn something that I can attach to something I saw today. And if you do that consistently over time, I think you will become a much better clinician.
That's awesome. That's very sage advice. Dr. Zanotti, thank you so much for your time. I know your time is valuable. That's been an honor for me to have you on the show. And thanks for all that you do. And we'll definitely do this again because there's a lot more
Absolutely.
wisdom that I want to glean from you. And
Well,
so,
I appreciate it and I really enjoyed it. Thanks for having me. It's a true honor and look forward to talking with you more, Hesham.
absolutely. Thanks so much. Have a great day. Thank you for watching. Sign up at healthcaremeetings.com to get every episode delivered directly to your email. And please don't forget to leave a 5-star review. Thank you so much.